We will continue this module with the next segment showing the anastomosis, end-to-end anastomosis on the femoral vein of the chicken. So what I did, I dissected it already and I flipped it from to the other side, from inside, the inside thigh. And you can see the vessel is here, much more accessible and visible from the other side. You're free to cut all of these muscles away so you can easily access the vein. So now we're going to do the vein. So there is another branch which I transected already, and we're going to do very similar procedure that we've done on the artery with the vein. The difference between the artery and the vein, the thickness of the walls. So the veins are very, very thin. So you have to be very careful not to rip it. But the end-to-end anastomosis is very similar done. So I'm going to apply. So now this time I'm going to cut the branch out. So I need more tissue inside. I'm going to pull those clamps a little bit further apart so I have space. You can use your fingers as well. So you can, but I'm using the clamp applier. So you pull a little bit more length inside because we're going to cut the piece out. Okay. Okay, so this is our branch, and I'm gonna use straight scissors to cut the branch out. So just make sure you don't pull anything. You just open the scissors, put the vessel in. So we're gonna cut this piece out. So you put the scissors strictly parallel to the vessel ends and cut. So the chicken is not as clean as the real vessel on the rat or humans, but idea is to have that done with 2 cuts. I'm gonna use the water and flush that vein up. I'm using ophthalmic cannula, which is 30 gauge, but you can use whatever needles you can have your hands on. Again, we're simulating something that you can do in a real clinical situation. Again, I'm gonna pull water inside the wound, and I'm gonna zoom closer so you can see better. So this is our vein walls, and this is adventitia. Sometimes vein don't have much, sometimes they have a lot. It really depends. And I'm gonna just cut a little bit from the side. There is not much on this vein. And here is a little bit more. I keep the gauze next to me so I can clean the tips of my jewelers. If you notice, nothing floating in my field, which is a good tip to have. You don't want any transparent tissue float into your anastomosis while you're peacefully suturing it. Okay, so this is, I'm gonna put a little bit more water so it floats a little more so we can see it. Then I'm gonna zoom out. Okay, so this is zoomed out. This is the vein, how it looks now. Maybe a little bit more trimming. Pay attention to how you cut, and you see the scissors are now go parallel to the side. If it's if you have glare, you can adjust the angle, how the light hits your field. So you see what I changed a little bit of an angle of the blue background, and the glare got a little lighter. All right, so this is it. You don't really need to dilate the vein, and you can use the clamp applier or jewelers to bring this a little bit closer. And veins are usually done under the tension, so you want to have some tension into the between the vein ends. So that's that. I'm going to use another 9/0 to suture it, and I'm going to zoom in so you can see. I'm going to adjust my focus a little bit. Always adjust your focus, always, because sometimes the veins in a chicken model goes in the angle, so it's hard to see. So now, as I said, the veins are very fluffy. So you see, I'm using my tip of the needle and the water so it floats, and I'm trying to adjust with the needle to see where I'm coming, and I'm gonna grab the other end of the vein and pull it to the other side. So something like this to see exactly where you're coming from. So this is a little bit too big a bite, but that's okay. So you see what I did? So basically under tension. Same thing. So you have to pay attention to see how it goes away sometimes, the end of a suture. And I let go and it goes away. So you really have to use your patience to don't snap. And I use, so I watch the tension. So you don't want to overlap something, because I took a little bit too big a bite. But I use my judgment how tightly I want to tie it, so it's not overlapping. It's okay to take a little bigger bite, especially when you're practicing, but you have to look so you don't over tie the ends. So I'm going to zoom in for the 12. I started with the 6. It doesn't really matter. You can do 6 or 12 in the beginning. And again, I'm using the needle as a guide. Put the pickup inside and kind of use the tip of the needle to see where the edge is. So see, it's not as clear. So I pull again like this and take the bite under the tension. And the same thing here, I put it in and pull away. Just make sure you're catching exactly your 12. And take your time, so don't rush. You're going to use your loops, so you're not going to zoom in as much. But you can still, on a vessel this size, you probably will be okay to use the loops. But I'm just showing you how you would do that in real life. In the microscope, you will be zooming in and zooming out constantly. So this is middle. Next one, so it's 12 and 6. Now I am actually gonna adjust the tension on the clamp. Pull them apart a little bit so you can see the lumen better. It's not perfect cut, but that's okay. I'm gonna use the tension because we have nothing So here I can use this in my hand, take the bite under the tension. So vein is, if you see, very fluffy. They want to be folded in. So you have to be really careful and watch the tension. When you tie, you don't want to take, so the bite size is very important on a vein. If you take the big bite, you're gonna have a folded flap inside the lumen. So if you take a big bite, it's gonna fold inside. So you really have to watch for the small bites on the vein, especially on the vein. So it's very similar to filling in the vein as we did on the artery, and the distance between the tissue, between the stitches, could be a little bigger, but the vein blood pressure is much lower, so it will be okay to have a bigger gaps. So now we completed the front the same way we completed the artery. So this is the middle and 2 stitches in between. So 5 stitches already in, and now we go into the back. Because the vein is bigger than the artery and more fluffier, we're gonna do, you can do more stitches in here. So, but I want to show you, I'm going to zoom in what I'm going to show you about the flaps. Okay, so now I'm going to show you that mistakes that I was talking about. I took a little too big a bite, and you see what I was talking about. This flap could be caused a problem. So this tissue that was on that bite got turned around, get turned inside and inverted. So you can pick it up from the back wall now and catch it, or it will catch the platelets and cause the thrombosis. So this mistakes is avoidable if you, well, actually, you know, here I can pull it out and put another extra stitch, but I did this on purpose so you can see what can happen. So on the front, on the back of the vein, we're going to do exactly what we did on the artery. So I'm going to put the middle stitch and tie it, because veins are easier to do under the tension. And then I'm going to put 2 stitches on each side of that stitch, and that will complete the artery. So if you notice, this is the bite size that I need to take, the small bites that will have no tissue inverted inside. In this way, I'm closing the 3 o'clock because I want to use that as the tension. So something like that. You can easily put 2 stitches in here. But you see how I'm handling the tissue with the tip of the needle, because I want to see where my bite are. So like that. Small bites, as I said, very important. Oops. Yeah, pay attention to that. The short end should be always be in your field of view. They're very easy to catch, to lose it. The big loop on the long stitch is very important because it gives you opportunity to move the instrument without disturbing your anastomosis. Okay, I'm gonna put the last stitch in, and we are completed the stitch, the anastomosis on the vein. See, again, I'm doing it under the tension and picking up my bites and exactly watching the size. Okay, so this is, we can trim. So this, the anastomosis is done. You can trim all of the stitches that you don't need, and we're gonna do the same thing here. You can remove the clamp. Okay, and this we can see the patency of the vein. Yeah, it has a, it will, it can use a few more stitches, but I think you've got an idea. You can put probably a few more, but we can, if you want to have assessment of your quality, you can cut this again out. And you can, if you leave one of the stays a longer, so you know how to cut this. So this is our 6 o'clock. It's good if you cut all of them at the same manner, on the same place. And you can put this in the middle. Okay, I'm gonna arrange this, and this is your anastomosis. So we can see that I already done a few mistakes. So the couple of stitches have too big a bites. You have inversion of the wall inside. We're going to teach you how to assess that, but this picture that we would like to have to see the quality of your work. So something like that. Well, now we completed all the modules, and I hope you learned a lot, and we're really happy you joined us for this course. So we would like to have your pictures sent to us so we can evaluate and assess the patency and quality of your anastomosis. We're going to use the ALICE score, which is anastomotic lapse index, and you can self-assess yourself, and we would like to assess you as well for research purposes. If you have any questions, please feel free to reach out to me directly on my email. And I hope to see you soon. Hope you learned a lot, and thank you again.